各位傳媒朋友早晨，多謝大家出席今朝11點鐘嘅抗疫記者會。今日出席嘅除咗有行政長官之外啦，亦都有政務司司長同埋財政司司長嘅。稍後啦，行政長官啦會有一個發言，然後行政長官同埋相關官員啦都來接受大家嘅提問。由於疫情關係啦，請各位記者朋友喺記者會入邊都係保持距離。戴口罩。我哋依家首先有請行政長官。
各位傳媒朋友、各位香港市民，今早呢個抗疫嘅新聞發佈會呢，係重點同大家交代下。
At the press conference today, we will brief you on our work in relation to COVID over the past month, as well as our way forward. At press conferences last week, we mentioned our work in this regard. That is, on February the 22nd, the SAR government announced a set of anti-epidemic measures in relation to the fifth wave of the pandemic, and we indicated that most measures will be extended till April the 20th. So why are we carrying out an interim review? Today is March the 21st. It has been 4 weeks since the last announcement, and we will reach April the 20th 4 weeks later. And one reason was the changes in the pandemic. On February the 22nd, I announced the anti-epidemic measures I mentioned. At that time, Hong Kong had a total of 53,943 positive cases and 145 deaths. At that time, we believed that the COVID-19 pandemic would worsen rapidly and the next 2 or 3 months would be crucial. And based on such analysis, the measures we announced on February the 22nd would be extended all the way to April the 20th. In the past 4 weeks, Hong Kong has been through a severe situation. As of February the 22nd, we had some 53,000 positive cases in total. So looking back, it was only the beginning. As of yesterday, the cumulative number of positive cases exceeded 1 million, and we saw 5,683 deaths. We can take solace from the fact that we were able to curb the pandemic, and according to experts, the pandemic has peaked, and this is clear when we look at the 7-day moving average. And we can refer to other indicators to identify the trend of the pandemic. Since February the 26th, the CHP of the Department of Health started accepting rapid antigen test results as positive cases, and that way we were able to comprehensively understand the situation in Hong Kong. So in terms of the number of positive cases from the 1st to 22nd of February, and incorporating the RAT self-declared positive results, we could see that we have experienced a peak period. Another indicator is the overall situation with sewage surveillance. As we explained yesterday, the viral load per capita showed a declining trend. Compared with February the 22nd, the viral load dropped substantially as of March the 20th, but we did see a rebound the past 2 days, and hopefully this trend would not continue.
另一個咧就係我哋進行嘅圍封強檢呢個早前日咧有同大家介紹，都係昨天同大家介紹過。
Yesterday we briefed you on our restriction, testing, declaration operations. We carried out more than 250 such operations. So in terms of the compulsory testing imposed in restricted areas, we could see that the number of cases has shown a downward trend overall. When you look at the orange line, you can see that we still face fluctuations. We could not say so far that the number of cases uncovered through the LTDs is declining. For PCR tests, they are mainly conducted at community testing centers and mobile specimen collection stations. And these cover mandatory and voluntary testing. Recently, more people have resorted to RATs, and that is why the number of PCRs conducted at these facilities dropped. Over the past 10 days, about 100,000 tests were conducted per day, and the ratio of positive cases detected saw an obvious decline. On 17th and 18th of March, there was a decline of more than 10%, which was great to see. And in terms of the effective reproduction rate, the Li Ka-shing School of Medicine has been monitoring the R0 figure. The latest figure has dropped below 0.5%. And on February the 22nd, when the measures were announced, the ratio was 3. Another reason we have to conduct this midterm review is reinforcement of our capabilities. And in recent days, the SAR government has reinforced our testing capabilities thanks to the support offered by the central government. And we have strengthened our capabilities in different areas in terms of the testing capacity. Our local contractors are able to conduct 300,000 PCR tests per day, and the mainland can offer substantial support by deploying sampling officers to Hong Kong and transferring samples to Shenzhen for analysis. The RAT kits are in abundant supply, and they are widely used, and we have distributed more than 8 million RAT kits for free. If the results show to be positive, one could make a declaration through the self-declaration system, and it has operated smoothly so far. The CHP has reviewed the self-declared cases, and no substantial abuse was found. And in terms of the anti-epidemic medical supplies arriving in Hong Kong from the mainland, they have been safeguarded with the strong support of the central government, and in due course we will be distributing anti-epidemic kits to all households in Hong Kong.
I'm grateful to the LegCo members, district organizations, clansmen associations for their voluntary raising of funds for distribution of these supplies. And they are tying in with the administration in the distribution efforts within this week. Work will be getting underway. In the kit, we have the RAT test kits to facilitate the household members to undergo a self-administered test to ascertain the COVID status. As more members of the public are getting infected and they are testing themselves at home and they are self-isolating at home. There was a time when we had to play catch-up, but right now these support measures have been improved. Now we have the anti-epidemic kits, which contain a whole host of items like thermometer, proprietary Chinese medicine, and oximeter, and so on. Now, in these, the distribution of these anti-epidemic kits is done properly. I've looked at the numbers over the past 3 days, and they have covered the infected people and the close contacts up to 100%. They've done it through the referral of the DH 280 hotlines from the HAD and 150 hotlines from the HA. The 23 vaccinating clinics are also in operation. 1,800 taxis and minibuses are available as part of a dedicated fleet to ferry people to the dedicated COVID clinics and also to the CIFs. So people are transported from their homes to these facilities. CIFs and CTFs, we have also ramped up the scale. We have the makeshift hospitals supported by the mainland. Each hospital can accommodate thousands of beds. This week, we're going to have one of the largest makeshift facilities that will be made available this week. We are looking after those who are in stable condition, the elderly people who are in stable condition, but not yet ready to go back to their homes. Now we have the holding centers. Today, we've announced that starting from today at the Kai Tak cruise terminal, we have 1,200 bed holding center that will be coming on stream gradually. The HA, having regard to the mainland experts' views on focused treatment, has already strengthened the Tier 1 and Tier 2 beds. The QE hospital and various other hospitals have been converted into dedicated hospitals for the COVID patients. So the number of beds for COVID has increased to 15,000. With the support of the mainland experts, we have managed to ramp up the capacity of the AWE for the third tier facilities. Private hospitals are working in collaboration with us. 1,000 beds have been made available to take on the non-COVID patients referred to by the HA. At the beginning of this month, or mid this month, we have started using the 2 antiviral pills to minimize hospitalization and progression into severe cases. Now, 3 batches of mainland experts have come to Hong Kong. I've met them all, and we benefit a lot from their input and their recommendations. We are truly grateful, and all these advice is really good for reference. Third, in answer to questions last week, I touched on this, and that is socio-economic development needs. Hong Kong is, after all, an economically prosperous society. There is a need for society to function continuously and for the economy to move forward progressively. So there are 3 areas where we have to review the measures. First, in the 5th wave, 9 countries have been imposed a circuit breaker flight ban, and this is no longer necessary because in these countries they are no worse than the situation in Hong Kong, and most of the travelers coming to Hong Kong do not have any symptoms. If we have this circuit breaker flight ban, a lot of Hong Kong people stranded in these jurisdictions will be really troubled, and we fully appreciate their anxieties and concerns. Some said that for the inbound travelers, the quarantine requirement is far more stringent than the infected people in Hong Kong and the close contacts in terms of quarantine and isolation. Things are more stringent than these inbound travelers. And this would affect our business environment, particularly in the US and European countries, and they're moving in the direction of relaxation. Third, we have to maintain our perseverance and confidence. The businesses and the members of the public must understand the direction of our anti-epidemic measures. Parents should know about the arrangement for caste resumption, and we have to make preparation for a relaunch of our economy. In the 2022 employment support scheme, this is entirely to pave the way for the relaunch of our economy. I've brought along the CS and FS to this press conference because this review is no simple task. We have to have regard to a whole host of factors, social factors, economic factors, and so on. All these combination of factors have been taken into account. The steering committee has considered all these factors over the past couple of days, and I am chairman of this steering committee, and all the bureau directors are part of this discussion for the decision to be taken. First, the COVID situation is still severe, so we have to maintain our anti-epidemic work. So all these measures announced on the 22nd of February should be extended until the 20th of April. So most of these measures will not be relaxed ahead of time. But having regard to the changes that I mentioned, we're not seeing any upward trajectory, because otherwise we will be very, very concerned. Now, there is about a month or so before the 20th of April. I think we have to focus our attention on treatment to minimize severe cases and deaths, and to take the pressure off the hospitals, and also to improve the situation in the homes. If you pay attention to the 4:30 press conference, the number of outbreaks in the RCHs and RCHDs is much lower. You may say that we've seen a lot of outbreaks, but this time we want to help them to recover. We have set up for this purpose a lot of holding centers for the elderly people who are in stable condition, and we put them there in the holding centers so that the homes can recover themselves. We have also relaxed the importation of labor so that we will have more carers to welcome back the elderly citizens.
Later this month, we would further expand our PCR testing capacity, as we announced yesterday. The CTNs, which were no longer issued in recent days, would be restarted based on our assessment, and we would promote the extensive use of RAT kits So in the anti-epidemic service kits that we will distribute soon, they would contain RAT kits. And we also urge NGOs to help distribute these kits to the public, especially vulnerable groups. And according to the CHP, the RAT test results must be declared within 24 hours. That way we can identify and treat patients early. We have established a series of objectives to boost vaccination rate by the end of April. And we set some targets on February the 20th, and they were largely met already. For members of the public, age 12 and above, the vaccination rate for the first dose exceeded 91%. For the second dose, the current vaccination rate is 82%, and hopefully in a month or so, this could be raised to 90%. For children aged 3 to 11, vaccination only started at the end of January. The vaccination rate for the first dose is currently 57%. Hopefully by the end of April, it can reach 90%. That way, they could be more reassured when they come back to school. For elderly people living in residential homes, currently the first dose take-up rate is 55%. But since some elderly people who have contracted the disease could not receive the next dose within a certain period of time, so by the end of April, for elderly in residential homes, we hope the take-up rate for the first dose would reach 90%. Finally, for elderly people aged 70 and above, the take-up rate for the first dose is currently 70%. More than 280,000 elderly people aged 70 and above are yet to be vaccinated at all. I hope the media can make more reports on why the elderly people should be vaccinated. In order to boost vaccination, we would fully implement the vaccine pass. The first stage was implemented on February the 24th. For stage 2, that is, people could only enter premises after receiving 2 doses, would be implemented on April the 30th. For stage 3, that is, the requirement to have 3 doses of vaccine would be advanced to May the 31st. So we urge those who haven't received the 3rd shot to get vaccinated soon. Like I said, according to the steering committee, the pandemic remains severe and most measures will not be relaxed. But we will be rationalizing the following measure. Starting from April the 1st, the SAR government would abolish the flight embargo on 9 countries and rationalize the immigration and quarantine arrangements as follows. This might be of much interest to many Hong Kongers overseas, and they might want to come back soon. Under Cap 599E, starting from April the 1st, we would implement the following measures, which would apply to all inbound visitors from overseas. In other words, we will no longer classify overseas countries or regions as type A, B, or C regions. In the first stage, the arrangement would apply to Hong Kong residents. Only vaccinated Hong Kong residents can board a flight. So normally that refers to Hong Kong residents who have received 2 doses of a vaccine and 48 hours before the expected flight, a PCR negative result must be produced, and a confirmation letter at a designated quarantine hotel for at least 7 nights must be produced, and they must proceed to a test and hold arrangement after arriving at the Hong Kong airport. If the traveller tests negative at the airport, we would issue a 14-day quarantine order. Even for individuals to be quarantined and isolated in Hong Kong, they would be subject to a 14 quarantine order as well. And the visitor would arrive at the designated quarantine hotel via a designated fleet. And during the quarantine period, the individual must carry out an RAT every day, and the RAT kits would be distributed to such individuals at the airport. Apart from daily RAT tests, on the 5th day at the quarantine hotel, the visitor must complete a PCR test, and in case of in a 14-day stay, the visitor must also carry a PCR test on day 12. For one undergoing quarantine at a designated hotel, even if the quarantine period is 14 days, if the PCR test on day 5 and the RT results on day 6 and 7 all test negative, the visitor can leave the quarantine hotel early. This is completely in line with the quarantine arrangements for those on quarantine and the close contacts of these individuals. If a visitor chooses to leave early, he must carry out self-surveillance in the next 7 days, and on day 12, he must complete a PCR test at a community testing center to confirm that he wasn't infected at the quarantine hotel during the quarantine period. If the visitor does not choose to leave the hotel early, on day 12, he would complete a PCR test at a quarantine hotel, and if the result is negative, the quarantine period would end after 14 days. For inbound visitors, tests positive via a PCR test during the test and hold period, or if the PCR result on day 5 or 12 tests positive, or if any of the daily RAT results test positive, then he would be transferred to a community isolation hotel. In theory, there should not be any infected individuals at quarantine hotels, so those who test positive would be sent to a community isolation hotel, and by then the individual would be issued with an isolation order and be subject to isolation requirements. The requirements are in line with locals who are undergoing isolation. If the RAT results on the 6th and 7th day were negative, the isolation could end. And in terms of, so these were the requirements for inbound visitors.
The schooling is very important to the children. I understand that parents are really concerned about the past 2 years. The in-person schooling has been in fits and starts. And according to the plan, as soon as April the 19th, in-person classes will resume. We'll start with primary school, international school, and kindergarten. For secondary school, we'll wait until the DSE to finish before we resume. The DSE is aimed to be starting on the 22nd of April. The Education Bureau is considering the contingency measures where necessary to delay the start of the DSE. After resumption of class, the vaccine pass will cover the teaching staff and the visitors. We do not require the students to be vaccinated to resume the in-person classes. We respect the children's right to education. But for the children, if the vaccine coverage is high, then it would provide the right condition for the activities to be resumed, like extracurricular activities and board games and so on. We're more relaxed about the secondary schools. 12 and 19 children is not the vaccine coverage is 95%. We are pushing the second dose. In the light of experience, those who have received one shot would normally be proceeding to the second shot. Now, for 3 to 11, there is a lot of catching up to do. They started in November. The vaccine coverage is 57% for the first shot. Before April, end of April, we'd like to raise the level to 90% from 57. Lastly, I'd like to talk about the social distancing measures. The Steering Committee Command Center is of the view that the COVID situation is still severe. We may have gone past the peak, and there is a sign of downward trend. But this is not enough to make us feel at ease. The number of 15,000 to 20,000 is still a pretty high number compared with the previous waves. The peak was something like 150 daily. This is 100 times over. So under these circumstances, it would be hard for us to relax all these social distancing measures right now. If there is no sign of a rebound, if the trajectory is showing signs of going down, then starting from the 21st of April, we will be relaxing most of the social distancing measures in 3 phases, in 3 months. So most of them will be relaxed. But there are still some measures that we will insist, like the use of the From Safe app upon entry to premises, and also the use of the vaccine pass. Premises have to be disinfected. There should be a number cap in public places, and also the wearing of face mask. No, previously, we tightened them gradually and relaxed them gradually. Now we have a clear roadmap and a timetable. We hope that there will be 3 phases in 3 months. First, we will be reopening these premises. So don't read them out one by one. The premises under 599F and also the sports venues, museums, performing venues, libraries will be reopened. So, but this is on condition that people will be wearing their face mask, except for the F&B premises, because people have to eat. For the others, there is a mask requirement. Now, for the group gathering restriction, will be relaxed to 4 people. Light dining can resume with 4 per table. Bars and pubs will continue to be closed until the next phase. That's the situation for the time being. For the second phase, all the remaining scheduled premises will be reopened. And the number of people, or the group gathering will be relaxed to 8 people. Beaches under the LCSD will be reopened. Jogging or strenuous activities outdoor do not require the wearing of face mask. And also in the first phase, it was relaxed to 10 to 12, and the number of people will be relaxed to 8 people, and bars and pubs will be reopened in the second phase. Now for the third phase, basically all the remaining elements, like the number of people, they will be relaxed, and basically we will resume or go back to a situation where we have the basic requirements like face mask, disinfection, a number of people, the use of Leave Home Safe app, and the vaccine pass production, and so on. Another area of concern is on the 22nd of February, we announced the CUT, the compulsory universal testing. After assessment by the committee, we decided to hold this in abeyance. We have done a lot of work over the past month. We have finalized a lot of the elements of the plan. We have assessed the manpower capacity, manpower requirements. That this CUT, if implemented, will be really on a massive scale, and there will be a necessity for restriction of movement. But having regard to the experts from locally and also from the mainland, they do have very much a consensus. They are of the view that the universal testing should be undertaken at the beginning or at the back end of the outbreak. The beauty of doing this at the beginning is to curb the spread of the virus. This is the timetable adopted by the mainland. For the latter one, it is intended to achieve zero COVID. Now we will be picking up the remaining carriers, and we'll be able to achieve zero COVID. But given the situation in Hong Kong, the COVID situation may be easing. The number is still on the high side, as I said. So the experts are of the opinion that it's not appropriate for us to devote all the finite resources to the universal mass PCR test. Some experts, not least the mainland experts, think that the community organization ability is weaker by comparison with the mainland. In the mainland, they have the street management, they have the district management network, but in Hong Kong it is weaker in this area. So we may have the legal backing. It would be hard for us to achieve an objective of universal screening. So when we decide the suspension of the CUT, the SAR government will continue to monitor the situation. Where the conditions are right, we will consider whether we will be implementing the compulsory universal testing. So to sum up, we have assessed the situation, but this is only a roadmap. At this stage, we will continue to monitor the development of the virus. Things can change very quickly, and I think people feel that time is passing very slowly at this point in time. But we will monitor the situation together with the experts. We will be listening extensively to views from the public and decide on the anti-epidemic measures that focus, and we will be people-oriented, and we will be achieving the best possible results with the minimum resources and minimize the impact on society and also on the economy. So much I have to say. We'll be only too delighted to answer your questions.
We now proceed to